Good evening, everyone, and welcome. It's been quite a year in our Medicaid journey, and lots has happened, and we want to update you. I'm Kathy Murahashi, and I'm the Public Policy Specialist here at the Arc of Washington. And my other most important role is mom, and I have a young adult daughter who has developmental disabilities. And I'm so happy to have my colleague here with me tonight, Sean Latham, who's going to help me present. And Sean, do you want to introduce yourself?
Yeah.
Hello, my name is Sean Latham from Young, Washington. I'm the Policy Coordinator for Self-Advocates in Leadership, a self-advocacy coalition working on legislative advocacy at the state and national level.
And we're glad you're here too, Sean. So yes, much has happened, and we want to give you updates about, what's happened, what it means, what you can do. When should we feel things? I think those are the biggest questions we're hearing from folks. So let me get let's see, it doesn't want me to, no. So change it to presenter view. Okay. So big question. What happened? And as you know, HR1, and we're trying to call it HR1. Its common name is the One Big Beautiful Bill Act. Some people are calling it the BBBBA bill. But we know it wasn't beautiful. But
yes.
It is what it is. It passed on the 4th of July, and it was signed into law. And you should know it was only by 3 votes. So that tells us a lot that this was a controversial bill, and that as you know, that there was a lot of pressure, and it was very, very close, which means advocacy was happening, and we thank you for that. It's so important that all your advocacy has been super important. This bill, it's important to understand that this bill came through what is called the reconciliation process, which is different than the usual budget process and the usual way bills happen. And what that mostly means, it's limited in what it can do. It pretty has to only focus on what they call mandatory things, which includes Medicare or Medicaid, and SNAP. And it also meant that in the Senate side, it had to have 60, or it just needed to be a simple majority to pass rather than 60 votes to pass a filibuster. So they weren't able to filibuster it. So that's why that 3 votes tells you why it was so close. And yes. So what did it do?
It was in the Senate side, it was a 50-50, and the deciding vote went to the vice president.
Right. So, but in the House, it was just by 3, and then the Senate, it was a tie. And so it was very, very close. So this bill created its historic cuts to Medicaid. We've never seen cuts like these before. In the entire history of Medicaid. It's the 60th anniversary, I believe, of Medicare this year. So in 60 years, we've not seen anything like this. We've had times when we've had recessions and other things where things were tight, but not in a non-recession time, just having straight up cuts. Between the it's about $1 trillion in federal Medicaid spending, that between now and 2034. So it's a huge amount of money. It's about a 20%, if you add them all up, about a 20% cut to Medicaid to the states. So, and what does that do? You know, we anticipate about 17 million people will lose their health care, and that's a lot of people. Mostly through administrative barriers. The 17 million is not just Medicaid. It also includes those in the marketplace exchange that had premium supports. And that's a big chunk of people. And we anticipate that some of those people will no longer be able to afford their health care without those premium supports. So that's where they come up with that $17 million loss. And most of the cuts really come through what we call administrative barriers. It doesn't say cut off a bunch of people from Medicaid, but what it does is it creates these barriers for people to be on Medicaid. And the next slide, I'll talk about those a bit. So the biggest thing it does is creates what we call work requirements for individuals on Medicaid. And this is for able-bodied adults. So that's kind of a term you're probably going to hear a lot, and they increase the age for folks to have to work from age 54 to 64. So now from age 18 to until you are 65 and eligible for Medicare, there will be, if you're an adult and you don't have children, you are going to be subject to work requirements. There are some exceptions, and we'll talk about those in a minute. This really creates barriers for people actually to work, because we know there are a lot of people that maybe need medications or medical support so that they can work. What it does is it shuts the front door. So you have to be working, then you can go in the Medicaid door. You can't not be working and get on Medicaid unless you fall into certain categories that, or you're eligible for SSI or have a particular disability, and that will be defined, and that's yet to be determined. So they have to, the eligibility, you must be between 19 and 64. You could either need to be working, volunteering, up to 80 for 80 hours a month. The other thing it does is it requires more frequent eligibility verification. So now in Washington State, if you're an adult, it's once a year. They're going to go to twice a year now. And again, this is for adults, not for children. So, it really penalizes you in some ways for working by creating these administrative barriers. It penalizes when you lose your job. So it's a real concern for people. The other thing is that it talks about parents of children. They changed the dependency age. It used to be children if your child was age 18. Now they've moved it down to age 14. So when they talk about childless adults, so if your children are over the age of 14, then you'll be considered a childless adult. So that really also narrows the door as well. And we're particularly concerned about those parents who may be caring for, at age 14, they may have a child with a disability that they can't, participate in after school programs and they need care after school. That makes it very difficult to work. So that's problematic. So the other thing that this bill does is it limits how states can raise funds. So it caps a provider tax, and this is a little complicated, and this is why it was difficult for people to understand this piece about it. So sometimes the state taxes certain hospitals and services, and they use that tax money to match the federal match, because you have to provide the federal match, and so by not allowing for them to have this, to raise funds through this tax, what it does is it turns it, the state's able to turn it around and kind of provide the services back to whoever the hospitals or whatever that they're taxing. So it's and they talked about, well, maybe that this was some sort of a scam, but they've been doing it for years, and it's been a stable form of funding to be able to provide that match to the federal, our portion of the match. So when that limits being able to do that, then it's going to be difficult they've got to figure out how are they going to make up the difference? How is the state going to be able to make up the difference for this? And this is where we hear, some of the outcries from hospitals. Rural hospitals are going to be particularly hit hard. We know that they have a higher percentage of people on Medicaid in the first place. And when those folks no longer have Medicaid, they're still going to need care. They're going to show up in the emergency room, which is much more expensive. And it's also it will cost the hospital a lot more money, which in turn will cost us all more money. If you have private insurance, our insurance rates are predicting that some of the private insurance plans may go up 50% or more next year, because they know that the insurance companies are going to be absorbing and the hospitals are going to be absorbing the cost of people showing up at the emergency room. And they're also concerned that just some of these hospitals are not going to be able to survive and are going to close. And we've been beginning to hear that, rumblings of that across. There's about 14, I believe, hospitals in Washington state that this could impact particularly. And then we think about we have Harborview Medical Center here in Washington, and that's a magnet hospital, it's the highest level trauma hospital and people come here from Alaska, from Idaho, and other places to receive care. And they have a very high rate of Medicaid clients there. And that's concerning that hospitals like that are going to be hit very hard with the costs of this. And what we were concerned about is some of the specialty things that happen at Harborview and other places like that. They won't be able to afford to keep these specialty services going down. That we've begun to hear of. Valley Medical recently closed part of their neurology department. So those are really concerning things. And the other thing that I didn't say earlier is there's a look back. So before the bill passed, there was like a 3-month look back and I'll only use my son as a example. When he was 21, he had a stroke, and he ended up in a very severe stroke, and he ended up in the hospital. And he was there for more than a month. And of course, he was a poor student. And although we had private insurance, but the cost was, his care was more than $1 million for the time he was there, just so you know. So because he was a poor student, he could qualify for Medicaid at that time because he was in the hospital as long as he was. And that look back allowed them to go back to the day he walked into the hospital, even though it was more than a month, and say that he could begin to get Medicaid at that point in time. And we are grateful for that because, we probably would have gone bankrupt without that. Because even though we had insurance, it was very costly. So that look back is being moved from 3 months to 1 month. So, as people, we know how long it takes for people to apply for Social Security and how long that takes. We worry about what happens in the meantime, or if they don't have that look back, that can be really problematic. So anyway.
This is Sean. Kathy, you have a question from Ruth in the chat and another in the Q&A.
Now I've got to see if I can find the Q&A now. Okay, I think I might have to. Can you read the question to me, Sean? Oh, let's see.
Yeah, I might be able to go through them though.
Okay.
Kathy, the Q&A is in the chat. Is in more.
Because I have my screen set to presenter view, so I can't see it right now. Let's see if I can find it.
I actually had the ones in the
hours.
Oh, go ahead, guys. I'm sorry.
Can you do a combination of work and volunteering for the 80 hours?
I believe so. I think that that's probably possible. I think we don't know a lot about how it's going to all play out and what they're going to consider eligible or not eligible for that. We hope so. Go ahead.
And then the other one is
Anonymous participant, 7:15 p.m. Does 6 Mo review requirement include data waiver case review? Q&A.
this month.
That include the waiver reviews? I think we don't know that for sure yet. We're hoping not, but it could be. Yeah. So we're waiting to see. There's a lot of things that we don't know yet, and we're still waiting to hear. Yeah, I know that it excludes children, I think. I don't know if you know, in Washington state now, once a child is under 6, is eligible for Medicaid, they stay Medicaid eligible until they turn 6. They don't have to have reviews in between. So that's a good thing. So I'm going to go to the next slide here. So when does some of these...
there is one more comment that Laura put in. It says, yes, 14, the media reporting this number in Washington. And that's according to what the last thing is from
For
Laura.
the number of hospitals. Yes, thank you.
Okay, yeah, that's it. Go ahead.
Yep. So when do some of these changes begin? And the first one is the premium tax credit that ends for people not on Medicaid, but are on the other piece. And I know that impacts a lot of people. That begins starting at the end of December, at the end of the year. So, you'll get your credit for 2025, but going forward, you will not. The other piece that's happening is they're redetermining certain populations, people who are non-citizens, but that are legal non-citizens. Undocumented people are not eligible for Medicaid right now, although our state does pay for some out of their own pocket, but our state is also being punished for that, losing some of their funding because of that. but there's certain groups of people that are here legally who are, immigrants who have come for, are refugees who are legally here. Funding for them is also being, eliminated, and that is supposed to begin October 1st, 2026. The work requirements begin December 31st, 2026. So those don't start right away. The re-eligibility begins December 31st, 2026. The cap on provider taxes begins October 1st, 2027, and it's kind of phased out. The retroactive, where we talked about moving from 3 months to just 1 month, is January 1st, 2027. And then those payments, special payments to the states, begin reduction in 2028. And there's a piece that I don't really understand about removing good faith efforts to erroneous payments. That doesn't begin till 2030. So I think the thing that you need to note here is that most of these are not, except for the tax credit, are not going away right away. And interestingly enough, a bunch of those don't happen until after the midterm elections, which I find interesting. So we shouldn't feel it right away, but you should also know that our state legislator, and Sean's going to talk about how this pushes it down to our state to make decisions, are already gearing up for how this is going to impact, and we will begin to feel it, even though these things don't individually don't happen right away, but we'll begin to see it, the fallout in our state budget starting this next session. It's going to be a very tight session. This isn't Medicaid, but but it relates to our folks with IDD greatly, because a lot of them are receive food benefits. So this bill also is the largest cut to food benefits in U.S. history. It's a huge benefit cut.
We have 2 more comments in the chat when you're ready.
Okay, let me finish this part, please.
Go ahead.
Let's see. 100. So it cuts about between 186 and 295 billion, depending on how they look at it, over the next 10 years from SNAP. That's about a 20% cut to states. And SNAP cuts also implement there's already work requirements for adults, but again, they expanded to 18 to 65, and that lowering the dependent ages of children from 18 to 14. The big deal is, used to be SNAP was 100% paid for by the federal government, and now states are going to have to cost share. So they're going to have to find money to pay the difference. And it's based on a weird thing on their error rate, which aren't really errors. It's just administrative things that they have. Most of the time it's like somebody didn't turn their paperwork in time, but they're still eligible, that kind of a thing. And then they used to share about 50%, the feds, 50% of the administrative costs, and that will go down to 25%. Again, putting more pressure on the states. Used to be benefits, they would go up for different kinds of reasons, like if there was a recession and such. Now that's going to be strictly based on the inflation rate. Again, it will limit benefits for certain legal immigrants. The thing that you need to know, we know a lot of our folks are on SNAP. About 30% of SNAP beneficiaries are individuals with disabilities and elderly people. So we know that this will hurt them a lot. And when do these things, the child dependent rule, moving to 18 to 14 happens immediately. The work requirement changes comes in June 1st, 2026. The cost sharing for states comes in 2028. And the guidance is going to be issued around legal immigrant status starting in December, and then we'll know more there. So, okay. Sean's going to speak in a second, but maybe somebody read me the questions?
I can do that. I have it right in front of me. It's Collier just basically says Peace Health in Vancouver and Bellingham and Friday Haven does not have a disability office, or they does not also have accommodations when searching their website. Has nothing to be found. And then Julie Huff says, might be a silly question, but does Medicaid gotten because of being on the basic plus waivers and being on SSI, i.e. Down syndrome, or also means Medicaid personal care hours and Medicare Medicaid medical coverage will be reduced or eliminated? ?
So we're gonna talk about some of those things in some of that's going to come up in the next couple of slides. I think we'll answer some of your questions. So I'm going to let Sean go ahead and do his part, and then we'll circle back if it doesn't get answered completely. Okay.
Okay, I'm just reading from the chat.
No, thank you. Yeah, I'll
This
get
is
Sean going.
Sean. Let us now turn to what the impacts are to us as individuals and our state. Next slide. If you can't see this slide, it demonstrates perfectly what will happen. It's a huge rock rolling down the hill, where a family is in danger of the rock rolling over them. Basically, how Medicaid services work is similar, that is, we get some of our funds from the federal government to supplement our state Medicaid dollars. So, when the feds cut their part of Medicaid, it just means those cuts shift down to the state, where our state must decide how to best use those fewer federal dollars. Next slide. This means that our state will have to react to fewer dollars coming in. What are some of those options, you might be asking? 1. The Developmental Disabilities Community Services Division, formerly the Developmental Disabilities Administration, may need to narrow the rules on who is eligible for services. 2. They might have to create a waitlist for waiver services that could hurt adults, those in transitions, and especially children. 3. The state may create premiums for care and add or increase co-payments to services. 4. Some of our more optional services, like dental and vision, may be cut or eliminated completely. 5. Our state may have to lower reimbursement levels to providers, which would probably mean fewer providers. And finally, 6. They may need to change the assessment rules in order to lower service hours. Next slide.
There we go.
This means that our state will have to react. One way we can think about what may happen with the Medicaid or SNAP cuts is by looking into the past. During the downturn in the 2000s, our state, like others, had to make cuts. Some of these cuts included a 5% cut to intellectual and developmental disabilities waivers, a huge 18% cut to home health, a service, in the personal care category, and an 8% cut to state planned services. These and other cuts that happened during the 2000s downturn negatively affected people with intellectual and developmental disabilities and their families. Next slide. So, you might be asking, aren't people with disabilities protected? Isn't that what is our federal government officials are saying? Well, unfortunately, many of our services are optional, including home and community-based services. While most of the government supports these and other services, they are still optional. It's the congregated settings that are not optional. In addition, 24% of people with disabilities are on the expansion program, many of whom may see their services cut or eliminated. And many people with disabilities are working and are making over the SSI limits. I am one of them, and we still require Medicaid services like personal care because paying these services out of pocket would make work almost not worth it. Next slide. So these cuts would generally hurt our community services. They would also provide incentives for congregate settings to stay around. Why? Because the bill exempts nursing homes and intermediate care facilities from pay the provider taxes that Kathy mentioned earlier. Back to you, Kathy.
So now what? One thing I want you to understand that I think we need to, we talked about the bill being a reconciliation bill. It was high priority legislation, mandatory spending, which was either taxes or federal debt limit or Medicaid or Medicare. And it only required the simple majority. So now you're going to start hearing about budget bills. And right now they're back into the regular cycle of yearly annual appropriations budgets. And that budget is different. It's the regular budget cycle. It's usually from October 1st to September 30th. These are what they call discretionary programs that are subject to filibuster in the Senate, and in the Senate would require 60 votes rather than just the simple majority. So there's a lot more space to advocate in this setting. But the president put out his initial budget, and he's calling it his 2026 skinny budget. And the cuts there were huge for people with disability. They were really talking about eliminating programs and services that people with disabilities have been fighting for the last 50 years. Initially they were going to make huge cuts to the P&As. P&As are the protection and advocacy system. That in Washington is Disability Rights Washington. There were huge cuts to our Developmental Disabilities Council, which provides a lot of funding. It provides funding for Advocacy Day, for DD Advocacy Day, and a lot of other initiatives across the state for people with IDD. Cuts to the Centers for Independent Living, University Centers for Excellence. Those particularly were hit hard in that budget. And in fact, I think they talked about just completely eliminating the Centers for Excellence and the National Technical Assistance and Training Network. Those are what they call projects of national significance. Those are projects that really give technical assistance to states around developmental disability services. It collects an enormous amount of data. There's the Braddock report that comes out, yearly, where they go through every state and they tell you the status of each state and, the quality of services in states and how it's funded. And in that skinny budget, I believe that would have been completely eliminated. There was also a huge cut to HUD, about a 44% cut to HUD, which is housing, Section 8, and cuts to vouchers and limits on vouchers. And they were just going to block grant the whole thing down to the states. There were also really big threats to IDEA, which is our Individuals with Disabilities Education Act. And it would have again, they love block grants. Block granted a lot of the funding, particularly for special education down to the states with cuts, and that would impact preschool programs, reduce funds for special education, training for teachers and cuts for counselors, therapists, and paraprofessionals. And again, fewer training opportunities for school staff to meet those needs. So I think that was when we saw that budget, it was pretty harsh and really, really concerning. So there's just a little bit of good news. That the Senate has begun to build their appropriation bills and for the next year. And the first part of it has come out of committee, out of the Senate Appropriations Committee, still has to go to the Senate floor and be voted there. And the House hasn't even started. But the good news is the Senate Appropriations bill was basically what we would call a flat bill. So it didn't make any cuts. It didn't give any increases, but it did not make any cuts. And I think that, I think this is a sign that our advocacy is working, that because this is a different process and it's subject to filibuster, they know that there's going to be a lot of pushback, and they know that they're getting a lot of pushback from their constituents. So we're a little bit hopeful. I mean, we don't like a flat budget, but it's much better than seeing these, all these things cut and sliced and diced, so to speak. The other good thing is, now this bill probably has no chance of passing at this point in time, but they put out a bill, Schumer's put out a bill, Protecting Healthcare and Lowering Costs Act, which would repeal a bunch of the things in the big, beautiful, the HR1 bill around Medicaid Medicaid specifically. It doesn't have a chance, but it's out there. And there's also another bill that would repeal that issue around the provider tax out of the bill. So those are some hopeful things, and in the midst of some really challenging things. Let's see, Senator Hawley from Missouri brought up the repeal the provider tax bill. And he has spoken out against some of the things around Medicaid. So I think these are small glimmers of hope in the midst of all of it. So let's see, 25. Really, this next year, we're going to continue to have to do work on kind of two fronts, the federal level and the state level. The federal level, the pieces around the budgeting for this next year, and hopefully maybe some pushback on some of the things that have already happened. That will continue. Pay attention. We're going to need to do work around that. But as those cuts from the feds come down to our state, the conversations change, and we really need to focus on our state legislature and talk to them about how these things are going to impact. They're going to have to make terrible, terrible choices. We're every agency we've been speaking with, every legislator, whether they're Republican or Democrat, are saying to us, there will be no new funding, not one dime of new funding next year. And the biggest picture will be, how do we protect what we have? Our DDA services, we see they've cut an enormous amount of case management. They're cutting staff at central office. So they're already putting into place some of these things. And they're already saying, we've got to figure out, how are we going to figure this out? So we're going to be really having to look and fight and talk about that this next year. And again, that piece about, are people with IDD impacted? So, they didn't say cut waivers. No, they did not say that, but they can, again, cut provider rates, because the state is really going to be looking to cut every penny. They're going to look, are they going to cut provider rates? Are they going to limit things? Our services are optional. I think the biggest thing that we may see over the next couple of years is, if they don't, right now, our state is really fortunate to have waiver capacity. Most states do not have waiver capacity for new people. And part of that is because our legislature has continued to fund the Basic Plus waiver for new high school grads. They've only 1 year in the past 30 years have they not done that. If that becomes into play, what happens is individuals who have, what happens is people are on the individual and family services, that small kind of preventive rate waiver. When they turn 21, they get to go over on that Basic Plus. If that's not available anymore, then that waiver fills up, we're going to start to see wait lists. And where that will hurt most is for children, because we'll begin to see longer waits for children to get onto services. 15 years ago, before we had that, people would wait 10, 15, sometimes 20 years to get on a waiver. So that's the concern and what we do not want to have happen, but we really need to watch for that and think about, protect that going forward. So I'm going to let Sean talk now.
Yeah, Bill. If I in the middle, something, man.
This is Sean. While many of the things we are discussing are difficult to hear and upsetting, we wanted to end on a more positive note. We know most of you, if not all of you, contacted your congressperson and United States Senator. You also contacted other local, state, and national leaders. And some of you kept contacting them, and kept putting the heat on them to do the right thing and not cut benefits. Although by a small number the bill passed, we wanted to say thank you. You did make a difference, and our Washington state delegation did hear from us, and they do know that we are not happy with the result, and we want them to make changes to it. I will talk in a minute about where we go from here and what we can do. Vote right now. Let's give all of us a hand in whatever way you want for a moment, because as the slide says, you've made a difference, and we want to honor and thank you for your advocacy up to this point.
Thank you.
Thank you. Okay, next slide. Okay.
Let's talk now about what you can do, and what you can encourage others to do. First, regarding these and other state and federal issues, please keep coming to events like this, to stay up to date. Second, sign up for the ARC action alerts. Both the ARC of Washington and the ARC of the United States push out email and website action alerts to notify you what is happening and what you can do to make a difference. Third, please keep up telling your story of how Medicaid, SNAP, and other programs impact you. Your story matters and will make a huge difference when you tell it to lawmakers. It can be as simple as saying, Hello, Senator Name. I'm Sean. I use home and community-based Medicaid services to stay in my community and be able to live life to the fullest. Please do not cut Medicaid. Fourth, contact your lawmakers by doing one of the following other ways. Make an appointment on Zoom or in person with your congressional delegation and your state legislators. Attend town halls and speak up. Write a letter to the editor. Make a phone call or send an email with them with your story. And you can share information on social media to tell your friends, family members, and community members about what is happening and what they can do to take action. And finally, please join us for Advocacy Days next winter. Our state legislators will be deciding what to do next, and so it is very important for you to stay up to date, and each Wednesday during session is a great way to do that at Advocacy Day. Next slide. Our big ask for our state and federal leaders is to tell them, no cuts to Medicaid, especially for services that people with disabilities use. We rely on Medicaid to live our lives. We need to stress that people with disabilities are not waste, we matter, and the services we need matter. They must not cut our credit services. When you do talk with your leaders or their staff, talk about the human cost of these proposed cuts will cause you, explain that they need to look at alternatives and again not cut our core services. Again, you can do that by sharing your stories. I think we can all agree cuts cause crisis and often leads to our country spending more money, not less. If you are speaking up on social media, remember to use hashtags to get your message out to more people. A hashtag is a word or phrase with the # symbol in front, like hashtag cuts cause crisis. Hashtags help connect your post to other posts about the same topic. Please use them. Next slide. We need everyone to speak up right now and let your voice be heard. Tell them you matter, your family matters, tell them nothing about us without us. We need to be heard and listened to as they make decisions. Tell them you are their constituent and you matter because you are a voter, and they serve you. If we all stand up right now, to say protect our services, we will be heard and we can make a real difference. Next slide. As the picture shows, keep your advocacy boots on. Things are constantly changing, it's not over yet. Keep advocating, keep speaking up and speaking out. We need to continue the fight. I'm a professional wrestling fan, and sometimes my favorites get knocked down, but guess what? They get back up, and they continue the battle. We need to do the same. Advocate, advocate, advocate. Next slide. As we mentioned, one way to make a difference is to call your congressional delegation. By calling 202-224-3121, this is the congressional delegation hotline. You will then have to tell them your zip code, and then they will transfer you to your representative's or senator's office. After that, you can share your message and your story with the office staff. Next slide. We want to again thank you for coming tonight, thank you for advocating, and we hope that you will pass on this information on to others. If you want to email me, my email is sean@arcwa.org, and if you want to email Kathy, it's kathy@arcwa.org. Now I will turn it back to Kathy for the question and answer part.
And we have about two weapons so far.
Okay, that's great. I'm going to stop recording during the question and answer time because I think people sometimes have personal questions.